Okay, shall we start?
Yes, please. Yeah, let's go. Yeah.
Hello, everyone, and welcome to our Connected Dent online event. Thank you so much for joining us today. We are very happy to see how much you care about your health. What is Connected Dent? Here. Just a quick introduction. Connected Dent is a non-commercial dental education project funded by former patients and dental professionals in the German-speaking region. Our goal is very simple: to make high-quality dental knowledge more accessible, especially for students, young professionals, and families living in Europe. We will be running monthly sessions, each one focusing on practical daily topics, from cavities and gum disease to oral care for children and dental systems in Germany. We also help you find a local dentist if you need one. About today's speaker. Here. We are very honored to welcome Dr.med.Detlef Schulz as our speaker today. Dr. Schulz is a fourth-generation dentist based in Essen, Germany. He's been practicing for over 30 years and has treated more than 15,600 patients, placed over 40,000 fillings and 15,000 crowns. In addition to clinical work, he has also taught at Witten-Herdecke University in the Department of Preventive Dentistry, and he continues to mentor young dental professionals. He's passionate about communication, prevention, and helping patients feel less afraid of the dentist, something I think many of us can appreciate.
Thank you very much, Wengxi. It's an honor to be here, and it's a great project you start for the common people in this platform. You are coming from your own story. You had some problems in your mouth, and you are not a person who says that's sent by nature, sondern to want to treat and repair and know more about this context. And in this way, you started a project which is Connected Dent. And Connected Dent is a very good idea to make a platform which is out of industry interests or other groups in the dentistry scene. So you start a very, very new project. I am really impressed what you did in the last months for us. And at least you have the first theme, and that's our introduction today. It's periodontology, everything around the gum. And so I'm really thankful to get this platform again. Before we start here, maybe you or someone who is watching this platform today, to grab a mirror, and to look a little bit more at the details. What's in your mouth going on? Of course, we have no dental treatments here or explanations, but we may be more sensitive for this theme, and that is our main point for today. So we are here now to open this first step for a better health and better knowing yourself and about your health future in the dental area. And when I look back in the last 30 years of my office, I had so many things like mythen, like storytelling about dentistry. So I decided for myself to open a new door to be more consciousness for yourself and for your future and for a better future and more health. So we start today with periodontology. To make a door open, I introduce first what we are talking with a model. I have here something like a model, and we are talking about the gum, which is this area, and connected with the tooth. In this area, many different daytime influences come. We have temperatures, we have mechanical aspects. We have many things coming to this area. And to be more clear what we are talking about, I decided to make a time channel. Here I have put together my experience about the last years. So we start with 0, then the milk tooth come, they go away, and afterwards the permanent tooth come. And here the story begins, or more or less in this area, between 15. And what happens here has an influence of your whole life. That's the first big point for today, that what starts here, you have to handle about the next 30, 50, 60, 70, 80 years of your future. Also, the mission is first, be careful, the first signs. Then when something is going away, it's really difficult to repair it or to bring it back. And normally people are thinking, oh, I have no pain, everything is fine, there is no problem. But the reason to go to a dentist without pain is not so common. Also my first big point for you is go if you have no pain, and let some professional go and look around and give you some information about your situations. The most important thing is we have only 28 tools and not more. And during the day, during the life, some cavities come more or less, and some gum seams. And first of all, we talked about here about the, and the gum is made of some, how my English is not so perfect, but I try the best. Also, we have some different stages from totally healthy until small signs, bigger signs. And here we have something really great. And when she prepared it for us to have a more visual aspect to what I say. Here are different stages of inflammation and health gum. And I start more or less with a perfect one, like number 7.
Okay, wait. We can't tell the answers yet. Okay, now people have to write in the chat that
I'm so
in which photos you think the gums are healthy.
So we make a quiz later. Okay, we have different stages of changing of the periodontally and mostly of the inflammation of the periodont. The system is always the same. We have bacteria and we have the organism, and both together are in the best way like a balance. Yeah, you have something who attacks and something who defends. And if it's in the middle, it's no problem. And you have the first test is maybe when you brush your tooth, your gum, and you see some red spots on your toothbrush. You have to be more or less, yeah, conscious. So you have to be careful, and it's the first sign that something might happen. The next level is that the gum is big and inflamed, but it looks from far away, it looks pretty normal. But that's the first step to next level of going away and losing the gum. And at least more or less, it depends on the age and some other factors. At least the tooth can go away and you lose it. That is really difficult, while when you lose your tooth, I have something like a model here, you have no tooth. And the construction to repair it or to bring the comfort back are so difficult and more or less uncomfortable or painful that it is easier to protect and to prevent than to wait. That's the second message for today. Even if there is no pain and no real sign, watch yourself, go to the dentist, and they can give you a good aspect what happens there. I bring you, for this case, I have here a model, and the dentist have something like a sensoring instrument, and we measure here, at least, the millimeters going this probe down in the gum. And if it's more or less 2 or 3 millimeters, that's the first sign something happens, which is not so good. The normal answer of everything we do here is the prophylaxis, the professional tooth cleaning in the offices. Nearly every practice is offering this concept, and it helps you to protect for the dentist word is biofilm, it's plaque on the surface of the tooth. And if the surface of the tooth is not able to fight against this bacteria, it goes away and goes back. So it is really, really important. And I give now to Wengxi, and she gives you some questions about the pictures you see here. I give to Wengxi.
Okay, so I would also like to add that a lot of people think gum bleeding is normal because it's so common around us. Like our parents have it, our friends have it, and you think, okay, I just have something like 牙龈上火. But that's not so simple. It's not something that you can just take some antibiotics and then it goes away, because it's likely that it's caused by plague and the teeth stone that is under your gum, and antibiotics don't help with that. And for smokers, they have a specific problem there, because nicotine stops makes the vessels, the blood vessels in your gum a little bit thinner, so you don't bleed so easily, but you still have inflammation in your gum. So for smokers, it will be really recommended that you really go to a dentist like twice a year to check if your gums are healthy. And here we're going into the next slide. And please take a look and take a screenshot of this one, because it's very important information. In the previous picture, we have shown you 9 pictures, and you might think that every picture looks very similar, and you think, okay, what's the difference? But then you can see that in the picture 1 and 4, they have very swollen gums, and that's already not good. But in other pictures that you can see sometimes that there's a little bit red somewhere, and sometimes you see that there's a very big gap between the teeth, and you think that can't be good. And there are a lot of posts on internet with this information that says the black triangle, 黑三角, is not good, and they will give you medicine or any kind of medication that makes you look like in the picture 1 and 4, and they say that looks good because you don't have the black triangle. But that's completely wrong, because in 1 and 4 they really have very bad inflammation.
Thank you very much for your great.
And now we are going to the next slide.
And
yeah, this one, please take a screenshot of this one and compare it to your own gums and to gums of your family members. This is really important, especially when you don't go to the dentist very often, or you don't go regularly, because to my experience, in my experience that, with other people that I have talked to, a lot of people in Germany, like expats, like Chinese or Americans, sometimes when they don't feel pain, or when they don't have a teeth that feels loose, they don't even go to the dentist. But no, you should, like regularly, like at least once a year. Take a screenshot of this picture and keep it and compare to your own gums and your family members' gums. Really, really important. But please remember that this only shows the inflammatory degree of the gums. This is not diagnosis. The diagnosis must come from the doctors, from the dentists. Okay, thank you. Let's go to the next one.
yes, so I have something to add in this point, which is more or less important. Here we can look behind the certain of the photos we saw before, because we have a tooth here and we have the bone. And in this area, there sometimes is the debris like calcula, like Zahnstein. And this is very, very, very dangerous because this is a rough surface and bacteria like rough surfaces and they go down to the gum and make a small and silent inflammation. But we have to be sure and aware that we only have one bone. And if you imagine you use it centuries, so 30, 50, 40 years, how many aspects can hurt and can change this situation. So our concept today is to brush away or to spray away the biofilm in this area and make a better balance for the defense system of the organism. Another more or less important point is diabetes. Many peoples have it, and it's a common civilization disease. But here we have a complete changing in the arteries and veins of this area. So we it seemed to be good, but as by smokers, here is some change process which you are not able to see at the first view. All over, we have to measure it by this periodontal probe, and with this probe we can check how intensive, how much is some destruction or not. Okay, I want to edit. Is it okay for you, Wengzi?
Yes.
Great. So we have today two big themes. The treatment of periodontal diseases is more or less a bacteria management. Dentistry have different possibilities. First, the extraction of the calcula, as of the stone on the tooth. But the second one is this biological film, and the toothbrush is only able to go more or less 1 or maximum 2 millimeters behind the gum in the direction of the tooth. And if you have a pocket by measuring with 3, 4, 5 millimeters, the toothpaste is really not able to clean this area. Also, everyone knows it's with floss or interdental sticks, the cleaning is important too. Okay, you have to add something, Wengzi, for this theme from your point of view?
Sorry, I'm talking in the chat.
Yeah,
I'm
no
very
problem.
confused.
Yeah, okay. I only want to ask you whether you have some aspects we have to add here. We have the biofilm, we have calcula, we have the surface, we have biological systems, which is another point more or less most have not on their view, is vitamin D. Vitamin D and K2 is a mixture which is probably needful for our areas where we live because we have not always sun. Okay, but in sun is not meaning we are in the sun outside and produce vitamin D. So substitution might be good, especially in the winter half year, to protect and to stabilize these processes in the gum area, for example. Yes, so we can put together, we have different stages. First stage is everything is fine and healthy. Second stage, there's a small inflammation, might be bleeding or not. Third stage is you feel like bleeding and you have some more alarm systems, signals. Fourth is the gum is going away and the bone too. And here is one important thing the most people don't know. The bone is not coming back if it's away. And when you remember, you bite on something and you have a much force and much power by biting on tooth, and you going in this wrong direction, you make it the bone going back, going faster back by mechanical reasons. So everything comes together. And on my time channel, I have this area at least here. Here we have the caries problems until the 30th, the 3rd century, nothing really by most people happens with the gum. But then it comes like a new risk and starting here and going till the end of the tooth and the life. So Here's the area you need to do more, maybe 2 or 3 dental professional settings a year, and here maybe only one. It depends on the age, on the biological balance in your system. It's a more or less important point maybe to add here.
And after my periodontal treatment, I had to go to the dentist for prophylaxis 4 times a year.
Yes, so it depends on the risk, but be sure, in former times we learned and we were treated to cut the gum away, which is a very hard and painful treatment, and we believed it makes the problem go away, but it comes again. So here is this biofilm, this biological surface, which is more or less poison for your organism. This is the most important point of interest and to manage it, not only by the toothbrush. Sometimes we can use for disinfection ozone, which is a very good concept because ozone is active and bacteria don't like oxygen and they kill through oxygen. So everything which is good for the arteria, for the auf Deutsch Gefäße. Sorry, German. For the Gefäße is good to protect your health system in the gum. Yes. Mengchi? Do you have some questions from the people or some
Yes.
things?
So people are talking about D3, K2, and one guest also asked if calcium is very important.
Yes, calcium, that's a kind of mythos, more or less. In our saliva, there is enough calcium normally to protect our surface of the tooth. Calcium is more or less to caries and cavities, which we have in the next part. For the gum, it's not really important. What very useful is that you take H2O2. H2O2 is very active oxygen and able to destroy this biofilm on the bacteria, so they don't like it. It tastes not good if you have an active fast, and we have another aspect which is commonly not so known, stress. If you are in a stress moment, someone dies, big problems in family, in your workplace, and your Abwehr means your protection is going down. In the gum area, you have it like a measuring instrument. Here it comes first. And the reason is very simple and not known by everyone. The reason is when you maybe have hurts on your surface of your skin, it repairs within more or less 3 weeks. Yeah, it's back to zero. In the mouse, it's only 3 days. Maybe you remember when you burn some area in your mouth, it's 3 days later, you don't feel it because it's a very fast changing process in the cellular area. And here is a special protection area from your organism, but it's not able to do everything. And the most important and best thing to help is oxygen, yeah, also Sauerstoff.
Okay, here we have a very, very good question. We have a guest who has done a periodontitis treatment this month.
Yes.
And he's asking how to improve the health of gum and teeth.
What is improve? What is
Because he has already had the treatment, and I suppose that he wants this situation to be stable, to improve, that he or she doesn't get this problem again.
Also there is no real, also gum diseases and gum processes are influenced by genetic aspects too. This point we don't have until now. So we have genetic points, we have stress, we have pockets, we have bacteria, we have different bacteria. And it's not like I do something and I have a result. So you have to explain and you have to try some different stages and look what really works. It's a really, really big question. In former times, we had a concept like giving 3 antibioticum to the same time, like a cocktail, and you kill all bacteria. But later, maybe months or years later, they come back and it starts again. So here is try and error, one of the more or less um, right ways to handle it. And you have time, and you need time. When you are able to clean the surface of this area, the organism is able to be repairing, but not new bone, only on this stage. Okay?
Okay, from my own experience, I've already acknowledged that the bones probably won't come back, most likely won't come back, but it's really, really important to start from now on, brush teeth very carefully, very thoroughly, that you don't have plague or Zahnstein coming back.
Yes. And here's a tip from the office, from day life. You can buy in the pharmacy some tablets, some small tablettes, and you bite on them, and there's a color which is showing you by color the bacteria you are not able to brush until before. Afterwards, you can see it, and you can optimize your technique. That is a easy and day life hack for getting a new level from your toothbrush effects. Yes.
And with the choice of the floss, there are different types of floss. To my own preference, that I don't like those very thin and those very flat floss, but there are specific floss that looks a little bit fat, and when it touches water, it becomes really fat. It expands, and then it takes away everything. But at first, it's quite tiny, and then after it touches your saliva, it expands, and then you can pour everything out. I like that one most, but the rest really hurts. And I think it's a little bit difficult to use, like those very hard and thin ones or those very flat ones. Yeah.
So I can add, we are trained as dentists to work with our fingers and with our tactile possibilities. So it's more or less easy for us. But if you are not trained, it's really difficult to floss between tooth number 6 or 7 in this area, or not to hurt you. Maybe the sticks are some possibilities to try another way. Yes, Vinci, you think we go to caries now?
That's one other question. So with the tablet, our guest says, I cannot ever brush 100% of the color off with my Oral-B electric brush.
Yes.
How
Okay.
to brush off all color? Is it even possible?
Okay. So try different Aufsätze mean different topics from this system. You have hard, middle, and soft. The soft is the most uninfective way. Middle is okay. Hard, more or less. The working is the phase, and this instrument has to be in a very, very good contact. And more or less, you have to choose maybe another Aufsatz, another brush type. Yeah, for example. But it's kind of trying and doing. Yeah.
And to be honest, is it so strict that every day we have to brush it like 100% the biofilm off?
No, it is okay. Then we survived, the human being survived since 1 million years or more. So dentists are only 100 years ago. Uh, yeah, the nature is able to protect himself, but we help, of course. Yes.
And for the patient, when you go to Haussmann, you can see those tiny little brush that can go through the area, the space between the teeth. And this is highly recommended by almost all the German dentists. This is very, very efficient.
Yes.
And
yes.
yeah.
And the reason is when you take the floss and you put it through your tooth, you have much energy because you have to go through. And then you, in the first moment, you press a little bit of this surface biofilm in this pocket. Later you floss it. But it's so difficult to handle that the recommendation of this interdental sticks, maybe you put it before in some mouse Spülung, mouse, yeah, like chlorhexidine, yeah, and then you disinfect this area if you see it very exactly. But more or less, the theme is a mixture of genetic aspects, behaviors, story, family, how I manage this cleaning process. So go to the dentist and let's check it. He makes this test with this probe here. It's in grade 1, 0, 1 until grade 4. Grade 4 is horrible. You don't want to have. But grade 1 or 2 is more or less not unnormal. Yeah.
Yeah, I shared a interdental brush in the
Yeah.
chat. So as an example. And when we don't have more questions about this part, we are going into the next section. Or do we want a 5 minutes break, or 2 minutes break, or 3 minutes break?
Maybe someone can pick up his this mirror for looking. Yep. For watching their own situation. But cavities are a completely different thing. So it's a good point to make a break, a small one. Yes. How much time we have, Weng-Chi?
We have something like, we were late for 5 to 8 minutes. We have another 30 minutes, I think.
Really? Wow. Okay.
That's good.
That's good. Okay, that's
Yes.
good. I love dentistry. It's a kind of family story. And when I was 12, I had the feeling to have go in this generation process and do it by yourself. It's a little bit difficult because in Germany you need a very good Matura, also Abitur. And more or less my Abitur was not so perfect, but I get the study place and started and yeah, became my graduation in 1991. So yeah, and then everything starts. So I like really to make small artificial things, but also introductions and helping to be more conscious for your health and for even yeah, getting the next level with fears, while many people in Germany are afraid of dentists. One reason might be that we are in a very near position to a person we don't know, and the other person really has only his feeling because there are no exact graduates how you can think how the dentist is really. Is he wanting to sell something? Is he want to make business? Wants to help you? It's a really different and interesting process in nowadays. Yeah.
Okay, I'm going to to advertisement, or it's not an advertisement. So if you find our speech or our lecture very helpful, we are looking for support, because we want to run these lectures completely for free and open to everybody. And to be able to keep this project running sustainably, we really welcome voluntary donations. The donation will go partially to our guest speakers and partially to cover the technical operational costs. And even a cost of a cup of coffee can really help us invite more experts. From our experience that we have, Dr.Detlef Schulz has spent over 2 hours on preparing for this.
Not
And
only 2, a little bit more.
okay, a little bit more, 3 or 4 hours. I think.
Because my English is not so good. I have to, wow, it's horrible for me, yeah. In German,
Yeah,
it is
that's
more
right.
fun.
That's right.
Yeah.
In
Yeah.
able to prepare our German dentists to speak English, to give us English speaking lectures, it really takes a lot of efforts. And if you are willing to, you can always donate, but this is no mandatory. I'm just making a small plea that maybe someone can give us a cup of coffee covered. Thank you very much.
Can we go to the dental part, maybe?
Yes.
Yes. So caries, I love caries. Also, here we have again this. I have to change now the background again. Moment. Yeah.
Wait a moment. What was?
Yeah.
Here.
Yeah. Yeah. You're fine. Good.
Yes, we are on the caries.
Yes. Now we have a very interesting process. We have caries. Here we see a typical career of tooth with holes with cavities. What happens? Cavities are a product of bacteria, especially one bacteria which is really known. It's known since 40, 50 years, nothing new. And the process is really clear, but clear means not that it's done. So what's the reason why? First reason is I have to look at my background because we have now a little bit more focus on surfaces. Okay, what happens? Bacteria are coming from outside, from the persons around in the first 2-3 years. The saliva is inflamed by bacteria. Bacteria live on the tooth and they need more or less 3 things. First, they need sugar, also Kohlenhydrate. Second, they need a tooth, of course. And third, they need a place where they are not brushed away. So if the time on the surface becomes longer, and this biofilm, again, it's a theme of biofilm, but in this case, it's a completely different process and completely different bacteria type. They produce like something like an acid, and the surface of the tooth is something like sandstone. Maybe some of you know then when we have old cathedrals and they're made of sandstone and the acid rain in the 90s destroyed the surface of this stone. And the same happens in the mouth with a hole with the surface of the tooth. So if the first group of this bacteria is coming and sitting down on the surface, the second comes afterward, and they make something like a combination of different combinations. At least they go to the first step of the surface. It is mostly not visible, and we need nowadays really much sugar. In former times, 20, 30 years ago, in Germany, we had a time where children became sweet teeth to be quiet and to become calm down. So we gave them much sweet things with sugar. And on this teeth, with the bacteria, we give the bacteria the best food they can imagine, and they did a very hard work. If it's possible to go through the first 3-5 years without holes and bacteria in the milk tooth, the permanent tooth coming from the 6th year until the 12th year, in this area they have no community of bacteria who helps them to destroy the surface of the tooth. And at least fluoride is in nearly every toothpaste. Of course, about fluoride we can talk hours, whether it's good or not. In our part of scientific dentistry, fluoride is a protection shield which is recommended to use. Means fluoride is something which is built by the saliva in the surface of the tooth as a protection shield. And the bacteria are not able to destroy with the acid the surface of the tooth. At least everything together means if you are able to have no significant holes until your 16th or 17th, 18th year you live, you are more or less, I know it's a little bit hard, this comment, you are more or less protected in the future. Because using a tooth cream, using the brush, brushing the surface of the tooth, having a perfect behavior to protect it in future, makes a good child to protect for the future. Something where it not works is when the first filling, excuse me, I have to a little bit here, maybe later. When there's a filling and the first hole is filled, also cleaned and filled, in the surface contact from filling material and tooth, it can be a small area where bacteria again can dive into this space and destroy the tooth again. So it is really difficult, important what kind of filling material you choose for filling your tooth. Also, first thing is when you get between 0 and 5 years, no holes, no caries, no cavities in the milk tooth, it's a good base for the next years that it becomes until you are 12 to 15. And there is also a time you get and you survive without holes and cavities. So this system might be really, really safe. The newest studies from German dentist organizations looking for a special index, which means the decayed missing filled teeth. It's something like a scala for results, and it means that 90% of the people in Germany between or 90% of the people in Germany which are 18, 19 years old, 90% have no cavities. It's really a great result of the last 20 years of protection and prevention in the time when you are a child or you are a young person. And so we have a really good situation for the future now. Of course, fillings are an exception, but fillings are two different materials connected in the mouth. They have different quotients with temperatures, with mechanic results. So here are some problems, and so it is really important to really think about what kind of filling you choose. I chose when I was in my university, we treated each other, and I come from a time where children became sweet tea, and they get caries. It was normal, it was nothing unusual, and every say, okay. When I started in our first year in the university, we make a test and we looked how many persons from 90 future dentists have no cavities or no holes, no caries, and we find only one person of 90. Today, it would be completely different, very good result from the last 30 years. So now what can happen in the future? What can happen during your life with the tooth with cavities? We need time of bacteria on the surface. We need acid. What we can watch and see is that in these energy drinks, many people like to drink, there's acid too, like in cola, the same. So here are some aspects we have to aware. It's not really difficult if you brush your teeth perfect, no problem, but it makes a changing of the surface. Here we have a timeline of cavities, which is a worst case. Then you don't brush or you are not able to brush. Anything, some other aspects came together. Normally, if the balance is done and it's done until you are 18, 19, 20, then this process stops. Really unbelievable when you came from 30 years ago, what happens in prevention now. Do we have some questions to this theme now? You have,
It's time to ask questions.
yes?
And I think, as far as I know, from what I have read about the dental disease data in China, is that we are 20 years in the
Yeah.
back of Germany.
Yeah, so you can do not the same mistakes than we in Germany. You can
But
be
we are making exactly the same mistakes, like
no, you don't
milk
do.
tea and that kind of stuff. And it's so difficult to persuade people. And now that there are also so many people saying that you shouldn't use fluid sound pasta,
Yeah.
toothpaste.
Yes. Okay. That's in my point of view, it's really a good starting situation because we have many things done here about explaining and la 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 and la la la. But if you one time check, it's really easy. You have one mouse. You are, as a woman, maybe 80, 82, as a man, 75, 78 years on this earth. And it's better with own tools, believe me. I have enough situations where it's not. It's only the only reason is to say, okay, do I want to be treated healthy, well, or not? And it's something you have to be responsible for your own organism, for your own body. You are the boss of your body, not any dentist or any other person. You are responsible for yourself. And especially in treatments in mouse, you have only at least 28 possibilities, then they're all gone. Yeah, only 28. And you live many centuries. So it's your turn to recognize and to be responsible for yourself and for interested in this theme, because the history showed in many countries all over the world that is protection and awareness of your health better than treatments. And here we have everything. We have, for example, I write a book. Yeah, this one here, which is I call it Zahnkompass. I choose here. Just one moment. I write a book where I had some capitals about everything I told here to you for my patients. And it's easy. You only have to do, you look the videos and everything is fine. So at least it's a kind of awareness. And when we have only one result today, only one, that you be more or less responsible for yourself, for your health, for the situation, and you can book like a buffet everything we have in these offices to protect your tooth, but you have to go. Yeah, it's not by doing by yourself. If you, for example, have a car and you use it for 20 years, yeah, everyone knows he has to repair, he has to put oil inside, yeah, in the motor, really, really simple things. But in the mouth, we have more or less, yeah, we have more or less some area where not so aware some, but maybe it can change in future.
Hey, there's a question.
It's only the why. Why should I do it? Because I have not so much pain. I'm more healthy. When I kiss another person, it's neutral, not with a bad taste. So in every space, it's good. Yeah, only doing and overcome the fears that something might happen. When if you do nothing, I think the result of today is something will happen. It's sure. The only question is when, not whether. Yeah, it's simple.
Okay, so there's a question in the chat.
Here's for example, this for me.
No error.
There are all answers inside, believe me.
Yes.
Yeah, okay, but now we are back here in our questions. Yes, please.
Can people still drink beer?
Huh?
Can
What?
people still drink beer? Because
Beer
it
is
also,
good. Beer is always good for everything.
but how do you protect your teeth after drinking beer?
Beer is nothing serious because it's not so acid like sugar drinks or white wine or cola, which is very dangerous. Also not
I
these.
drink cola too, but I completely clean my mouth right after.
Fruit juice is similar. Everything like lemons, for example, everything where's more or less you taste an acid is not so healthy and not so good for the surface. But believe me, we have a repairing system in the saliva of the mouse is enough to repair it, but you have to be everything you do too much is not good, and especially yeah, something which is sour like cola, for example. Yeah. Okay, you have some other questions, more or less?
Can I ask something?
Yes, please.
So I always heard from other people that after you eat some fruit or drink some juice,
Yes.
somebody say you have to brush your teeth immediately. The
No.
others say that you have to wait for half an hour
Yes.
after to
Okay.
brush your teeth after that. What is correct?
After an hour or later, because the saliva has a protection shield and a protection system to rebalance it. Yeah. More or less
After an hour.
after an hour or more, but acid is no reason to brush at once your tooth. Because
No, because I have a big problem. So I have some cavities in my teeth.
okay.
So my dentist told me that because I always drink my first glass of water in the morning
Yes.
with fresh lemon juice.
Okay.
And he said this is not a good idea.
No, if it's good for you, why not? But you have to
It is
wait.
good for me. I do it since 20 years. But my dentist said that's the reason you have the cavities in your teeth.
Yeah, I'm really not able because I cannot look in your tooth and cannot look at the surface. Okay, and it's only a common comment for me for you. If you drink the water with citron, no problem. You have to wait. Afterwards, you can drink a normal water and wait maybe some hour for brushing the tooth. That really nothing will happen, at least through this behavior.
Okay, so it's not right to brush my teeth immediately after I
Yes,
drink this water,
yes,
right?
that's a good idea to brush it later.
Okay.
Yes.
Okay, thank you very much. That's
Yes,
it.
of course. And here we have again the tooth surface, and here is the animal. Animal is 99% 99% mineral. It's completely mineral. And so it's a really good protection shield. When you take the other side, here we have now a look inside the tooth. We have the three different stages. We have the enamel here, dentine, and nerve. And now you see how important it is to protect your tooth with cavities with a good kind of filling. Why you can only thrill in your whole life maybe 3 times at one tooth. Afterwards, the nerve is activated, is destroyed, or is not healthy again. So you need a nerve treatment, or it's extracted this tooth, and you have a free space, or you get an implant or a bridge, or I don't know what. So be aware that this tooth is very small, it is very sensitive, but it is on the other hand really strong because this protection shield is good, really good. But if it's broken through a filling or something else, then this process comes, and as you see in the size of all those things here, we have no much space between the schmelz and the nerve. And here is the secret of everything. When you make a filling, be aware that you are always, the filling will not be kaput, not destroyed, but it wash out. It is sponsors for face changing. The composite, also the connection between filling and tooth might be stressed. So you have a next one. Okay, it takes years normally. There's a special zone for grandpas and grandmothers. Around 70 years, when you're 70, normally the saliva is not so much than when you are young. And then the whole system in the mouth change, and caries came back like from the heaven. It comes like buff, it's back. And everyone thinks, yeah, I have my whole life, I have no holes, and suddenly I have holes because this balance between acid and basic is changing. Yeah, it's only a special thing in this period of life. In the time between, if you make prophylaxis, you make a protection of the surface of the animal, everything is more or less in a balance. And choose a good filling. That's the most important thing. And ask your dentist which kind of filling he would prefer with his tooth. And not he wants to sell you. Ask him. Be not shy. Okay.
Okay, what is Mundwasser? Is a Mundspülung?
Yes, yeah. And nowadays, in the last 10 years, there come very intensive pastes and Spülungen to protect this surface here on the this face of the tooth. So it is able to go by chemical processes. If you do calcium hydroxide in the suspension on this tooth, it can diffuse in the protection shield of this tooth and make it better and repair it. It is possible, yeah. But you have to be a little bit geduldig, means you have to wait. It's not with one process you protect everything. Normally, the saliva is able to repair it by the biological normal processes. The best beweis, means proof, is that the people between 20 and 30, which have a good history of protection, they have not a sign of holes in their mouth because this shield by normal day life and toothpaste is good working. Yeah. Any questions?
I have another question about the filling.
Yes, please.
You just not told us which filling is good, which is not. But if you go to a dentist, you're not sure whether the dentist will tell you the truth.
Yes. Okay.
So how can we see that? How can we judge which is good for us or which is only about money?
I know. That's a really good question, and I think it's it's a center of all questions.
Yes.
Okay, let me give you an answer from my bottom of my heart.
Okay.
I choose the system by the size of the hole of the filling before. Okay? First of all, we have to analyze how big is the hole and where is it. Okay? Is that okay for you? First step. Second, you take the minimal invasivist way to protect or to fill with the today materials. And it's between composites, also filling materials which are white, which are done with a lamp, with this blue light. And the only problem is to make the contact point with these materials because we need some Förmchen, some formers. And sometimes it is not perfect to rebuild the contact to the tooth beside. Second, in this time where I was educated in university, we had these materials not. We only had amalgam, gold, and not even ceramic. Today, we do many ceramic systems, but the tooth has to have a really not small filling or not small surface which has to be repaired because ceramic is very sensitive for point forces. When you bite on a small area of ceramic, it's similar to animal, so it's difficult to protect it from cracking. Yeah.
Yeah.
At least I'm a fan in the knot in this area. You cannot see it as on the back. Yeah.
Yeah.
That's important to bite. You're not on a beauty contest. Yeah. It's important to bite in the future. There is gold, probably good material, auch even today. Most dentists don't do it or don't offer it anymore because they have not learned it. It's a little bit difficult to work with. But gold is a golden standard. It means not ceramic standard. Yeah, sorry.
Yeah.
Okay, in this area we can see it. It's ceramic or resin, also composite material. A crown is a protection concept too. Most people think when I get a crown, I'm old. No, that's not true. It is the age and the story of the tooth which we protect with a crown. A crown is something you put over and you protect the small rest areas of animal before cracking. Yeah, it is like a protection shield.
Yeah.
So it's not bad or good. It's a construction which is pretty known since 100 years, not so new. Okay, that's a border between crown and filling, which is more or less depends on the point of view of the dentist, which kind of concept he prefers. Yeah.
Oh, and
But
even
there
from
are different materials for crown. Huh?
Please, excuse me.
There are also different materials for crown.
Yes, of course.
There are also ceramic. There
Yes.
are all
Yes. Yes, you are right, of course. In nowadays, this process is a special question, but I want to answer it. The material is, in my point of view, what is important. When you can see it, of course, the aesthetic aspects. Okay. But more or less in the back of it, it's not aesthetic. It's have to be protect the forces of biting.
Yeah.
And maybe auch aesthetic, but you don't see it on the 7 tooth. Yeah. Okay, long story short, choose a material which needs not so much high and high of the material to protect the tooth. If you thrill away not so much material from the tooth, and this what you choose, maybe metal, maybe metal, for example, because you have a thinner tolerance of protection. You understand maybe what I mean?
Yeah.
If the material needs more space, you may have to put more from the tooth.
Yeah.
And you, as I told you, you can thrill in this tooth 3 times, 4 times alive. That's 50 years. Yeah. And you have really to check out which material could do it. maybe a story of my office. When I started in 1995, we made with a German magazine for dentistry. We make a small essay from the office day life. So we make some resin fillings with this technique, like one floor, the next one, and then dry it or not dry it, make it hard with this lamp. And the same patient came until now, and the same filling are in the mouth. And we have documented it in a magazine. So it's really a system which is not bad, this technique with the layers, one layer, second layer, third layer. It's a bit difficult for dentists, and we have another problem which the most patients don't have on their mind. We need time. When we make a good technique, we need time. We are not like a robot. We have to create something. We have to be exact in every way. So we need time. But we have, from the German insurance system, we had a Pauschale. It means we have only one price, even if it takes 5 minutes or 50 minutes. So it is difficult for dentists to make the spagat between time,
cost.
quality, costs, and everything, like all over the world. So here it can be a good technique if you have time, and when you say, okay, this tool has a worth from maybe 100, 200 euros, it's not much, about 20 years, for example, then you get the chance to have a good filling. Why not?
So what I understood, the filling is like 3 layers or even 4 layers. This technique is still used, or not all the dentists use it, or only a few of them use it?
Yes.
Because I want to go to the dentist and ask them for the filling, and I want to tell them I need exactly this kind of technique, technology for 3 layers or 4 layers.
Yeah, you have to ask them, how do you do your filling? My point of view is that you as a patient, not you, that patients together become more selbstbewusst. More selbstbewusst. The dentist, not like I lie here and do what you want, sondern please explain me.
Okay.
Because it's a difficult situation, because you lie on your back. Your foot are in the high. You have like a latz. You have like a paper here, and you have the lamp. And then in these situations, you should ask someone about serious things. It is really difficult, in my opinion. But you have to be safe and say, okay, I have only one tooth. I have 3 times in my life. Please explain me why and how do you will protect my tooth. Yeah?
Okay.
It's,
I learned something. Thank you very much.
Yeah, you have to be selbstbewusst, conscious.
Okay. Again, another thing is, when you're talking about filling, I think most of the time you also have to talk about the crown at the same time. So the among all of these different materials for the crown, which one is from cost and endurance a good choice?
Also a good choice is maybe zirconium. That is completely ceramic material, which is not so big as in former times, and biological neutral. And with the technique today, with the scanner and with the digital processes, you can do them very exactly and very predictable.
Okay, so but I guess it's a little bit more expensive than crown or made of bronze or other metals, right?
It depends on the structure of the praxis. I cannot say for everyone.
Okay.
It's a technician theme. As a dentist, you make a technique, you make your preparation of the tooth, and the dental technique comes as a Zulieferer, as someone who bring it in the office, of course, and there you have to ask the dentist, well, I don't know. Okay, I hope I can help. I don't know. Yeah.
Okay, thank you very much.
But when you say it, on the other hand, you do a crown in your life more, maybe like fillings, maybe one or maybe a second time, but then the tooth is away. Yeah.
Okay.
So, yeah. I cannot answer this question because every office has different systems and yeah, processes. But at
Yes.
least we have
Okay,
a
thank you very
common
much,
system
Dr.
that
Schulz.
the thing is explained. Okay, great. Yeah. Yes. Then you have some questions?
I think, am I a bit stuck or are you a bit stuck?
Yeah, we have.
Okay, so what's your
Okay, no
opinion
problem.
on toothpaste? Which are
Okay,
good?
what's the question?
Your opinions on toothpastes.
Okay. That is a little bit like a religion. Okay, also normally every toothpaste you can buy in Germany is through processes and it's safe. Yeah, it depends really of the taste of it. The whitening toothpaste are promised something which most times not work. Yeah, that's another theme too. Also, it is, if you want, you can change your toothpaste and take one this time, next one buy another one, try it. You cannot do something really wrong. We cannot, in my opinion, because everything is very similar. Yeah.
Yeah, those ones that I bought in Germany, I actually can't tell difference when I use them, and unless it's like specifically targeting
Yes,
periodontitis.
no, now I think let me see. Yeah. Also, are we still on the online? In my point of view, is there something changed or not? Or I don't know.
We are online. Is there a problem?
I have only miniature now because I don't know why. I can see you, everything is fine, but I can not see my Bildschirm anymore. Doesn't matter. At least, okay, toothpaste, more or less important than the toothpaste is the time of brushing. Most people became a behavior, and behavior becomes on the use. When you have your Prägephase, means when you learn it, you are often doing the same processes which might not be perfect. So here is the key to success, not the toothpaste, sondern the technique. Choose an electric one. Choose one which is more effective than the hand brush. Yeah, every study we have is that electric brushes are better than the hand brushes. Yeah, that is important. And the time. Yeah, 2 minutes are really a long time. 2 minutes are 2 minutes. And in the morning, and in the evening, the same. Yeah. Okay, sorry for that. That is more.
And there's a warning about a whitening toothpaste. Is
Yeah,
that
no,
in Germany? I think toothpaste are safe, but in Asian markets, like
yeah.
in China and in Korea and in Japan, there are some kind of toothpaste that are in the market.
Yes, that's true.
They are too abrasive, and I have used one from Korea. I used it for 1 month, and my teeth went sensitive for 3 months. I
Yeah.
thought I was going to lose my teeth.
No,
But
you don't,
okay.
but you are true. You are right. In Germany, that's really no problem. Be careful if someone explains you something like a wonder. Yeah. If
It
someone,
actually worked because it actually removed one layer of my teeth, so it looked whiter, but
yeah.
it was terrible. It was a terrible experience.
So please, only takeaway message is do it longer, check it, do some bite tablets for anfärben, also for show you the bacteria and to brush them away, and that's the easiest and the cheapest way to protect. Yeah? Can you see me at least, Vincing?
Yes, I can see you.
Okay, because
Everything's good.
I have here something which is not okay. It doesn't matter. So at least, yeah, we have some questions more.
I think I'm just going to have your slide on.
I want to say something personal, something which comes from my heart. I love this beruf, this profession dentist. It's great to make small things happen and to create something like an artist, yeah. But you can have change management in behavior, consciousness for yourself, for your organism, step over fears and overcome it and get in a new room for health and yeah, for a better future in your mouth. And we live in a time where everything is like a buffet we can choose from and put it together like a coaching program. Not everyone needs a complete brushing program. Someone needs it. So trust your dentist, ask them, ask. Yeah, and go in a better dental future, yeah? You only have one mouth, one tooth in a place. There's no second chance. And yeah, be aware of your tooth.
And there are a lot of very good dentists in Germany. And if you have bad experience, like this is like a personal advice that not all dentists are very nice. I had one terrible experience during my trip because at that time I couldn't understand German.
Okay.
And he was treating me while talking about real estate with his assistant.
Okay. Yeah,
And
it's in every business, in every, ob you have, keine Ahnung, in a restaurant, some are good, some are not. It is like, it's human, yeah?
yes.
Dentists are humans too, as you told, yeah? We are humans too.
Yeah.
And
In this situation, still, it's like for your own sake, it would be good to probably look at different dentists.
Genau, it's another thing. Maybe you can see me still, or Wing-Chi?
Wait.
Yes, now I'm back here, more or less, I hope. You can see me, yeah? Wing-Chi? Can you see me?
I can see you.
Okay, perfect. Everything is fine because I have disturbing here in my monitor. Doesn't matter. So it was really fun for me because it's not my comfort zone to speak English. Second, yeah, I don't know how it happens, how it works for you. At least dentists is a business or a job like others, but here we are connected with persons, with human beings, with fears, with ja, maybe auch Vorurteile, also means old meanings, and we have to change and to be part of the new time, and you can get nearly every information you need on this social media channels. Inform yourself, you only have one mouse, yeah. Of course, on the other hand, we are energy too, yeah. It's a kind of energy thinking, but on the other hand, the tooth is made of 99% mineral, and then you is energy another thing, like when you have some stone, okay? Yeah, from my point of view, we are good. We have a good session today. What do you think, Wengxi?
It was great. Lots of fun. And we had a lot of interactions with the guests.
Great.
Thank you.
Welcome. Really, really nice to meet you. We meet maybe 1 year ago, more or less. What do you think, Wengxi?
I think it was September last year
Yeah,
in
more or less.
Wolfsburg at the event at
Yeah. And
Fundamental.
so I was really impressed, and I had a project in 2016. I went sometimes to Shanghai and to Beijing. So want to make some contacts to the Chinese market because dentistry in Germany is really good proved, and we have good technique here and everything. So want to make some combinations systems, but we have a break of years, so things slept. But now it's a new chance, and I like it. And I like to be in China too. I enjoy the French Quarter in Shanghai. It is so great there, the atmosphere and so on. Yeah, but it's a long time ago. Good.
Okay, Dr. Schulz, may I have a last question?
Please.
Okay, I need to replace one tooth. It's taken already a couple months already, so I will get a planted. Yeah.
Yeah.
So how much roughly should that one tooth cost?
Okay. First of all, it depends on the base, as you know. If they're in the first phase, if there's something to do like new bone treatment, also to create new bone, it takes longer and it takes more money. More or less, an implant is between €1.5, yeah, and the crown maybe 600, 700 euros. So altogether 2.4 might be.
2.4.
Yeah, around.
Okay.
Okay, here I have a little bit more information that because I have talked to people who have done implantat both in China and in Germany, is that you can always go to multiple implantologist and ask about a rough price. And do not choose the cheapest because some people have told me about the experiences that sometimes they choose the cheapest one, like both in China or in Germany, that there's a reason why it's too cheap. And sometimes the more expensive ones, there's a reason why they're expensive.
Yeah.
So I can't talk about details because this is very personal and different.
Yeah.
It can be very different.
So you can take the CD picture, so and then ask different dentists to make a Kostenvorschlag, basically.
Yes, you can. If you have the CD, the three-dimensional analysis, you can take this and go and say, okay, what do you recommend? What is the way you want to treat with system, blah, blah, blah. And then, it is at least, to read the comments on the website or on Google is not bad. Yes, of course, you can see something like an overview, but nature is individual and it's not predictable. Yeah. Even if you have a technique and everything is fine, there is sometimes factor X which makes it or not. Yeah. We are not God. Yeah. We are a technique, but mostly it works. Yes, of course. And you have to wait until it's really inside the bone and it's connected with the bone. Then normally it's gone. It's done.
Okay.
If you have questions during the healing process, like for example, you feel something's loose with your implantat, you should convince your dentist to maybe make a new X-ray, because there have been cases where the dentist says, I've done everything right. But just like Dr. Schulz said, for everybody, it's personal. It can't be the same everywhere for every person. So sometimes everything's done correct, but it still went wrong. So if you feel something's wrong, try to convince the dentist to take an X-ray and check everything, because sometimes they don't know better because the tooth is not in them.
Okay, maybe it's good to take a camera or audio recorder to the treatment.
No, that's not necessary.
Okay. Yeah.
Good. Yeah, great. So fine. Now we are really nearly 1.5 hours. Oi, oi, oi. A big compliment to all who looks at this format here, because outside it's summer and it's great to sit down, meet some friends and drink, or I don't know what. But you are here on this phone and on this program here from our from our project. So thank you very much to be here. Yeah, it's a great honor for us that you choose us, really, because it's
Thank you.
It's
Yeah.
dentistry is something you make a real. Normally, you make a circle around and say, oh, yeah. But to be here, it means that you are able to go in the next level and say, I want to know more. Maybe I have an idea. And okay, I had checked, I have only one try for a tooth or two, and then it was, yeah, it's great. So in the background, we have now Shanghai. Yes.
It was very old picture.
Yeah. But I have another one from Shanghai too. This is Shanghai too.
Mm.
It's Old Town and new one connection. Yeah, good.
Great pictures.
Yeah, I like to make photos. If you look at my Instagram channel, you will see all over the world, many places, many great atmospheres. It's a little bit like a hobby for me to be aware of.
Very nice.
Yeah. Yes.
So thank you. So see you next time.
Oh, moment. We are also going to translate the book. We're planning to translate the book into Chinese and post on our WeChat official account.
So, no. Here's a book. It's only you can. It's only in my office. I did it with a project with a television station here in Germany. We make a project together, and as a result, this book. And I do not give it to a verlag, so I have all the rights inside with me, and I have to ask no one what I can do out of it. And so Wengqi and I, we will do some research and doing it more or less not in German system, sondern in international style. So when it's possible to order like an ebook, we will inform. Maybe make another session about it, because it's like a compass, meaning compass. Zahnkompass means you are mutig, you are aufgeklärt und angstfrei. It means fear eats tooth. Ne? Fear eats tooth.
Yeah, great. So it's worthwhile to wait for the Chinese version.
Yeah, we are doing it. We are more or less,
okay.
But it takes a little bit time, of course. It is really a project which is more or less by chance. It was not months ago or like this, and
That's the best.
Yeah, we are in the flow, and we find she is in the Chinese market at home. I have the tradition of 1895. First dentist and family, so we have some of both parts, which is sometimes really interesting. Yeah.
Very good. So we look forward.
We do.
Thank you.
Welcome. Yeah, Wengqi, sometimes it's time to say goodbye.
Yeah.
Genau.
And it's a nice Friday.
Yeah.
Yeah.
We have done some good things, I think, for dentistry, for thinkings, for old behaviors maybe to change. It's fun. Great. Good. What is about Liang? Is he still on air?
Yeah, I think he is. But
Yeah.
maybe he's.
We have to say hello and thank you to Liang, because in the background he is doing some technical work for us. So
Yeah, I think so.
he is not in the front, but in the back office. So thank you to him again. Yeah.
Our next seminar will be held by me and Paul Petranata. She's here right now. She has been answering questions in the chat.
Yeah. Hi, I'm looking forward to see you all in about a month,
Yes.
more or less.
25th of July.
25th of July, yeah. I will preparing good, and yeah, it was a lively session today. I think congratulations, Wengqi, for that. I think it was a success. Yeah.
Yeah, thank you.
Perfect.
We have recorded everything, and I will edit and add subtitle and publish to YouTube and also on WeChat official account. Yeah.
Great.
Great.
Can I say something in the end again?
Yeah.
I think it is from some age up, everybody needs to do a filling and so we cannot avoid the topic of insurance. Maybe you can, when you're doing the summary of this edition, maybe you can include some suggestion, recommendation of private insurance for the dentist, you know.
Okay, the billing and insurance, we already have a session being planned in September. I'm already in contact with one the financing company, and they are very cooperative.
Okay, thank you very much. Very good to know.
Great.
And if you want to keep updated about our future seminars, you can scan the QR code and join our WeChat group, and I will keep everybody updated. Thank you. Any other questions? I think we don't have more questions, and we can call this a good seminar. And schönen Freitag und schönes Wochenende, everybody.
Genau. Happy weekend.
Yeah.
Happy weekend.
Have a nice weekend.
Ciao.
Thank you very much.
Thank you.
Have a
Thank
good
you, Dr.
weekend.
Schulz.
Bye.
Thank you very much.
Ciao.
Ciao, ciao.
Soll ich ausmachen, NG?
Ja, ich bleibe bis zum Ende.
Okay, gut.